Here's where I want to start on this topic. There's a reason that ACBC has this as part of the normal sessions to go through in their basic training, because of this issue is so prevalent in our society. It's going to come up in conversations and counseling topics. But I am not, as Michael said, that type of doctor. Even though I'm going to reference people who I think have done good work here, and I think it's important for us to know. But before we examine some of the discussion as we think through topics medically and physically, and then how that relates to our goals as counseling, let's start with what we're talking about: people. And God has revealed to us about people, because he is the creator of people. And so before we talk about things like the mind or ideas of mental illness or things of medication and drugs and brain and the bodies, let's talk about people. And what does the scripture tell us about people? And really this topic of biblical anthropology. That's a fancy way of saying, what does the Bible tell us about people? How did God create us as people? And I think that's where we need to start, with what God says in his revelation. So the scriptures really make an important distinction between the physical component that makes us up, our physical component, our body, and our immaterial component, the soul or the spirit, that both are essential parts of the person. We're not just our body, and we're not just our immaterial soul or spirit. That both are what make us who we are. And that's important. And, just as a side note, I would argue that the words soul and spirit are used interchangeably in Scripture. There's some that would look at that there's a real hard distinction that the scripture makes between soul and spirit, or maybe mind. I've even seen diagrams of that people have shown me. But as I look at, and I gave you a bunch of scriptures, we're not going to look those up, just look at how similar passages are using those words for the immaterial part for us somewhat interchangeably. That even if there are different ways that maybe that God created us in those ways, there's a broad category of the immaterial, which seems to be used in this idea of soul or spirit interchangeably, that we are embodied creatures where God has breathed immaterial life, right? There's both body and immaterial, physical and immaterial. The body is distinct from the soul. Death's going to bring a separation between body and spirit. Really, in sum, here's the key verse, 2 Corinthians 4:16, and I have a little error here in your notes, I think. It's not 4:6 down there, 4:16. Though our outer self, so as we think of these two different parts of us, there's the outer self here, Paul says, is wasting away, right? There's the outer self of us, the body of us, and then there's the inner self, the soul spirit, that is being renewed day by day. So that's the way that the scriptures describe how do we think about people. So if we're going to talk about things like what's going on in the mind, or what's going on in the brain, or we have to classify, what are we talking about? Are we talking about body, the physical, or are we talking about the immaterial? Now, whether, the huge difference isn't between what's called dichotomy, right, just physical, immaterial, and trichotomy, which would say body, soul, spirit. The issue I'm pushing against is what's often called as monism. This issue of monism is really talking about that it's only the body. And there is no category for that biblically. We are not just physical, that there's a physical and there's an inner man and an outer man. There's a body and a soul spirit. And so even though as biblical counselors, we are not always experts on the medical implications of the outer man. We're just not. In an hour, you are not going to become an expert on the brain. You're just not. And in fact, even our experts on the brain aren't fully experts on the brain. They're still trying to understand this amazing creation that God has done in creating the human brain. But because of, as we understand how God created us, that we would recognize that the importance of, that we can understand what's going on in the body, but we understand the importance that we're not just our bodies. That what's going on in the soul, spirit, the immaterial part, which we've been calling the heart, right, is incredibly important. So that's where I want to start with, is just this understanding, anthropology, who we are as both outer person, inner person, body and soul, spirit. Now, and before we talk more there, I want to give a couple caveats as we approach this topic. The first one is that anytime we discuss this topic, the theme of compassion has to be prevalent. Most people are not on medication for fun. At least when we're talking about medication for things like depression, anxiety, ADHD. Parents, as they're wrestling with whether or not they're going to put their kids on ADHD medication, they're not saying, oh, wouldn't this be fun? Right? That's not what they're doing. People aren't on these because they're always looking for an easy way out, or they just think it'd be a fun thing to do. They're doing so usually out of desperation, out of suffering, because they just are trying to function day to day. And so there's incredible compassion that we need to have as we're thinking about on this subject. Again, 1 Thessalonians 5:14, which I talked about in my last session. Not everyone is idle. There are some that they may say, there might be some people that are looking for the easy way out. But that's not everyone. There are those who are weak. They just don't even know that there's another option. They're suffering, they're weak. This is really the only thing that's been given to them that's any hope to help them. And so, of course, they're going to look for that option. There's others that are faint-hearted. They have been suffering for so long. So we're told to be patient with them all. We're called to have love and compassion. So we want to approach this subject of compassion. We also want to approach this subject with humility. And these were notes that Brendan emphasized that I kept on, is that you are not a doctor. And even those like Michael and I are in this room, you're not that type of doctor. Now maybe some of you are an MD in the room. But for most of us, you are not a doctor. And in your role of your biblical counselor, that is not your role. We are training and thinking through to deal with matters of the heart, not matters of the outer man and the body. And so we don't want to ignore the importance of the body. As Michael said, when in doubt, check it out. Right? That there's an important role that medical care plays, that we look in, even in the New Testament, that there's a value in God's common grace of medical care. So it is good to recommend that counselees get a physical checkup. So a lot of times, if it's not in the PDI that I use, that I'll have conversations and I'll ask, when's the last time you've had a physical checkup with some of these levels of thyroid and whatnot checked and other indicators checked out. And even beyond that, the physical questions, not just of what could be not missed, but even just what are the other medications they're on and the physical side effects that they could be on. And so those are just important to be knowing. But just as a reminder, you are not a doctor. You are not one who is able to prescribe medication, and you are not one then who is best qualified to tell someone when and how to get off medication. That is not our role. A lot of these medications have very serious side effects and withdrawal symptoms if they are stopped too quickly. And so if there is a decision to stop the medication that your counseling makes, you need to work alongside the medical professionals to be able to walk through that process. You are not a doctor. Do not try to pretend you are one. So if that's the case, why are we addressing this topic? Because it's common. It's incredibly common in our culture. It's going to be incredibly common as you seek to bring hope and help with people. As Martha Peace has said, a biblical counselor needs to know enough to be able to counsel someone who is apparently over-medicated and can't think straight. We want to help equip you so that you understand enough to be able to give good, godly counsel as we are thinking through these issues with others that we're counseling. So here's where I want to go with this. Let's talk about this. And I put this in your notes, but I want to use it this way. Let's think about the difference between a medical, there we go. A medical diagnosis versus a psychiatric diagnosis, as we're thinking through these two things. And so the difference between a medical diagnosis, as we're thinking about, versus a psychiatric diagnosis. So if we're talking about medical diagnoses, we're talking about something with an identifiable, ID, pathology. That's the key term there. Pathology. It has a pathology of a medically identified cause of the disease, and because there is a medically identified cause that can be identified and measured, then the appropriate treatment can be given, right? So if someone comes in with a broken arm, that can be distinguished and measured and seen by the x-ray, and then they can be treated, right, with resetting the bone in a cast. If there's a bacterial infection, right, that there's a treatment of antibiotics, which more and more nowadays, right, they don't just, I remember when I was young, if you got a cold, you could get antibiotics just like you get ibuprofen nowadays, right? Now they're saying, no, we actually have to do the test, we have to do the swab, because we can't give you antibiotics unless, what? They actually identify the bacterial infection, because they don't want to give antibiotics for viral infection. Why? Because if they can't find the actual source of that infection as bacterial, the routine over-medication of antibiotics can actually cause long-term problems of the resistance to antibiotics, which is why they don't give it to, I don't know, if anyone's had that experience where he's like, I just want to go in and get my antibiotics, and like, nope, sorry, did the test, it's viral, not bacterial. I'm like, I still feel awful. Like, well, come back in a week. Right, because they want an actual pathology. They want to be able to identify the bacteria, so they get to give that antibiotics. They want to have if you have low thyroid levels, right? Hypothyroidism, then you have the treatment of the medication. Or if you have high blood pressure, right, then you get the treatment of ACE inhibitors, right? It is identifiable pathology of what is not just the supposed cause, but the actual cause and the measurement of what that is for the appropriate treatment. When we're talking about a psychiatric diagnosis, the challenge is we really don't have an identifiable pathology. I mentioned this earlier in talking about depression. We can't measure with a test or a cotton swab or a blood test of things, we'll talk a little bit later, of neurotransmitter levels. Right? It's not an actual pathology that we can measure and test. So if you go in and you're being diagnosed for some of these psychiatric diagnoses, what is done? It's not getting a blood test or getting an x-ray or getting an MRI or a cotton swab. It is identifying from a list of common symptoms. Right? It's through the Diagnostic and Statistical Manual of Mental Disorders. You may have heard it as the DSM. Currently it's the DSM-5. It's the 5th edition, which has pages and pages of disorders that have various symptoms. If you meet these symptoms, and if you meet so many of these symptoms, then you could be classified as having that psychiatric diagnosis. But do you see the difference between this pathology, which is testable, which really comes from the test, versus a pathology, which is just the idea of symptoms? That's there's something different as we're thinking through this here. Because there's no test to identify the pathology behind those. Now, it's not to say that there isn't something going on. What I'm saying is we don't have the pathology, we don't have the tests for that. And so what happens is, because you can't measure, is this viral or is this bacterial, then how do we know what to treat? It really is up to the individual medical professional to really try to guess what is going to be the best medication for treatment. Again, I am not a medical professional. I'm going to recommend a book for you, though. I should have brought a copy, but I didn't. I'm sorry. But this is Charles Hodges. It's in your other resources at the end. He was really helpful in thinking through this. He's a medical doctor and a biblical counselor. Charles Hodges, Good Mood, Bad Mood, Hope and Help for Depression and Bipolar Disorder. And he tracks through case after case of these issues of the problem is that because we don't know exactly what the pathology is, they have to kind of guess, see if that helps. Sometimes it helps, sometimes it does nothing, and sometimes it makes the symptoms way worse. Why is that? Because you have no pathology to test. And so that is what makes these psychiatric diagnoses so challenging. And again, I'm not saying that I'm not saying that there's not brain issues going on. I'm saying we can't test and measure and identify the pathology and measure what those are. So the best that can be offered is a guess and check option for medication. And the other challenge here, there's another book that came out recently. Again, it's in your notes there. It's by Jen Chen. It's called Biblical Counseling and Mental Disorder Diagnosis. The problem is that even, not just from the biblical counseling world, but even from a secular counseling world, they're looking at these classifications of the DSM, and they're noticing there's a lot of overlap. So if you look at the categories for depression of symptoms, and the categories for anxiety for symptoms, and the category for ADHD and symptoms, well, there's a huge amount of overlap. So how do you know which drug to give? You don't. And so it creates an incredible challenge. In fact, I was just telling Michael, I mostly listen to biblical and theological podcasts. I've got a couple sports ones that I throw in there every once in a while at the gym. But I like listening to one or two secular podcasts just to hear what is going on. What are people talking about? I disagree with their worldview. I disagree with them a lot of the times. But I think it's helpful just to know what the discussion is. And I found it interesting. It was about a month ago, and there was a writer for, some secular, New York Times or Atlantic or something, but he had written a huge article pushing back against so many ADHD diagnoses. And this is not from a biblical counseling world. This is just someone who's doing the investigation. And one of his big things is saying, how can you asking the counselors, secular counselors, why ADHD and not depression or anxiety? And a lot of times it's like, well, it's kids, and so if I have to choose between the three, I'm just going to give them Ritalin instead of the other medication. It's like, well, that doesn't sound very scientific, right? And so and that's what he's pushing back against. So even from a secular worldview, that there's a lot of questions about this over-medication because it comes down to this issue of pathology and measurement. Again, hear me right. I'm not saying there is nothing that is going on in the body. I'm not saying that. I'm saying at best, we can't test it and we can't measure it. And so that does make these diagnoses very challenging as we think through the difference between a tranquilizer for anxiety versus an antidepressant versus an antipsychotic. Right? Some huge differences in medication that can have huge side effects for the people that might be coming in to get counseling. It really comes down to this idea of no testable pathology. And if you think, and here's where Michael was going earlier, if you look at those list of symptoms, the list of symptoms of, well, if they have, are they fearful? Are they worrying? Do they feel prolonged sadness? Are they showing anger? Well, it even comes up with that classification of mental illness. And here's what Michael, I think he's saying, and he can correct me later in the Q&A. I think what he's going is, it's a misclassification. If we're calling it mental illness, what is mental focused on? It's the mind. Is the mind, biblically, are we classifying the mind as part of the material or the immaterial? It's immaterial. Now the brain can have an illness, right? Our physical body can have an illness. And it can even have an illness that we are not able to be aware of or be able to test yet or have a diagnosis or a pathological test to understand what the pathology is or measure. At that, the brain can experience an illness or a deficiency. But if we're talking about mental, if we're talking about the mind, we're not talking about something that is physical. We're talking about the immaterial. So if we're talking about the immaterial, if we remember this that diagram that we talk about, we're talking about the fruit that we see, and then below we have the roots, and in those roots is really, right? It's the heart, a little heart guy. And what makes up the heart? It's our our wants and our thoughts, right? And our emotions. I'm just gonna scribble there so you can't see my spelling. Ooh, isn't that the mind? Isn't that another way we're calling the mind? Is this mental that we're talking about, the heart there. So that's what he's pushing at. He's not denying that there can be an illness of the brain or that there can be a deficiency in the brain. Yes, there can, but that's not mental. And that's not the mind. And if we chalk all those things up as just only physical, then we're not actually thinking about the person as God describes how he created us, both inner man and outer man. So yes, there is we even have some identifiable pathologies of the brain that affect the brain, that affect these things of, a pathology of thyroid and postpartum depression and brain tumors and traumatic brain injuries. There's clear ones that we already can identify and have tests for. And then there might be some that we have not identified yet, but we have to be humble enough to say, we don't know what those are, and we can't test what those are, and so we can't be sure of what the actual right body and brain treatment is for those. But no matter what those are, and Michael set us up really well in his last session, we can always address the heart. If we're talking about what's going on in the mind, what's going on mentally, what are they thinking? What are they feeling? What are they wanting? Well, as a biblical counselor, even if you can say, I don't know what's going on in the brain, we can address the heart. And that's what we want to be able to focus on. And we want to be able to give hope, right? What happens if all we are is brain? There's no hope. There's no hope. Maybe the only hope is maybe they're going to find the right medication. And then you keep guessing and checking, and what did that do? It robs someone of the hope. And instead of to say, listen, no matter what is decided as they work with their doctor, our hope is not based on them finding the right medication. Their hope is that they can glorify God no matter what is going on in their brain. Right? That is possible. And so we don't want to rob them of hope. We want to be able to address hope. I give a couple quotes from Charles Hodges there. I really like, again, Dr. Charles Hodges, medical doctor. He says this: I will never call anything a disease that the Bible identifies as sin. Again, that's what we're talking about, mind, right? We don't want to just chalk that up as a disease. He says, so much of what the DSM-5 calls a disease is simply inconvenient or disagreeable behavior. So we want to be biblical as we think, if we just call that a disease, then there's no hope. You're diseased, we don't know the right medicine, so there is no hope for change for you. But that's not true. The hope is that even if you have, even if there are certain things that are going on in the brain, your mind can be renewed, Romans 12, right? Your heart can be changed. Your inner man can be, back to that where we started, renewed day by day. That is possible. Charles Hodges also says this, Dr. Hodges says, just because pathology has not been discovered or demonstrated, it does not mean that no disease is present. So we don't want to just jump to conclusions like Job's friend does and say, yes, there's definitely nothing going on in the brain. we can't say that, but we can't say that that's all that matters. Or to say that because that's going on in your brain, that you're just a victim to your thoughts or emotions and volitions, right? That we understand that of our biblical anthropology differently. So we want to listen, we want to gather a lot of data, we want to sit with compassion. If I have someone come in and again, they say, I'm diagnosed with depression. Well, actually, first someone will say, I have depression. One question I'll ask in data gathering is, is that something you were diagnosed with? Or is that something that, how did you come up with that conclusion? Because I think, it's just helpful to know what they're meaning, what they're thinking in that way. But what I want to start doing is I want to start thinking through with biblical labels. I want to start thinking biblically. Again, in my first session, I'm not going to say, no, don't use that word. I want to start thinking biblically so I can then eventually help them to start thinking biblically. But we want to say, in humility, we can't for sure say, well, we have no pathology either way. All right, let's talk. So where is the supposed pathology for these psychiatric diagnoses? It's really this idea of the chemical imbalance theory. And so if you're not aware of the fancy name there of chemical imbalance theory, it's the idea of serotonin and these neurotransmitter levels that are low in the brain, right? It's this idea that there are these neurotransmitters that are at the wrong levels, they're imbalanced in the brain, and because of there's not enough of these neurotransmitters, then there's these results of things like depression or other sorts of these illnesses. The problem is that, actually it's a twofold problem. One is the mechanisms, even amongst neurologists and psychiatrists, are disputed. They can't agree how the mechanism of the neurotransmitters exactly works. Again, it's not to say that there isn't issues with the neurotransmitters. It's saying they just can't still figure out exactly how that works. But the biggest issue, there is no test. There is no test. If you went into your primary care doctor, if you went into a psychiatrist, or you went into a neurologist and said, hey, can I get a test for my level of serotonin right now? They can't give you one. There is no test. Again, that's not to say that there isn't some problem that may be going on in the brain. I'm just saying that there is no test to be able to identify that, and we're thinking about this idea of what is going on there. And even secular research is starting to challenge this. This is not for the biblical counseling movement. This is from major universities and psychiatric study and psychological studies where they're challenging this. So 2022, there's analysis from the University College of London that's finding that depression is probably not caused by chemical imbalance in the brain. More and more of, even amongst the field of psychology and psychiatry, is starting to challenge the chemical imbalance theory because they're just not finding the evidence that they need. Again, not to say that there might not be biological brain issues going on, but it may not be that one that they've so long thought that it is. So if you have someone come in and you're meeting with someone and they ask you, well, okay, do antidepressants work? Should I do this? It was recommended to do this. Will they help me? Well, we have to think there, right? We have to define, what do you mean by work? What do they want by work, right? That is the key. That's the key issue. Now, if we just talk about work, if they mean by work, probably what they mean is that going to change my circumstances and experience? That's probably what they mean. Well, even at that level, there's questions. Right? There's questions of, they certainly have not worked as many have hoped. In the sense that they can be effective if they find the right combination and the right people. They can have some positive outcomes for certain people, but they have not worked to the point where that most of the medical establishment is hoped. And so Dr. Kirsch of Harvard Medical School, I put his quote here. He said this: to summarize, there's a strong therapeutic response to antidepressant medication, but the response to placebo, that means just a sugar pill, right? Just a test that doesn't have any medication, is almost as strong. This presents, he says, a therapeutic dilemma. The drug effect of antidepressants is not clinically significant, but the placebo effect is. what should be done clinically, what should be done then clinically in light of these findings? Again, I am not a doctor. It is not my role to put someone on medication or take someone off medication. But if someone is coming to seek counsel, right, we have to, if someone's saying, is this gonna work? Should I do this? Will this help me? We need to define what is meant by work and help. We wanna make sure that they're not placing their hope there. That's the key. That even if it helps in some of their symptoms, it's not going to fix their heart, right? It comes back to the idea of, even if we fix our brain, it doesn't mean then that our heart and the way that we think and the way that we feel and what we want also changes. So that's not where our ultimate hope is. And even then, it's an if that can relieve symptoms, if that can fix, right? And so we even if outer man issues are involved and they have some relief, medication cannot fix the inner man. And so we really want to make sure that people understand that where are they looking for what helps? Where are they looking for what works, right? So that is something as a biblical counselor we can walk people through, that even if they decide with their doctor to go on these medications, that what is the purpose and what is the goal from that? Because medications are not going to help them glorify God. If I take this pill, I get to glorify God tomorrow. That's not the end goal of that, right? So what is our role then as we think through counseling and medication? Within ACBC, there's some differences here. There's some differences as we think through this. Here's a suggestion that I tend to give. This was also in the notes that Brennan had as he wrote up for the ACBC training for this, is that in specific circumstances where your counselee decides to work with their doctor and they would decide to go on medication because they believe that it's going to help them. They want to try to see if it's going to help them function in some way, but they're not placing their ultimate hope there. That's not what's going to fix them. That's not what's going to put their hope in, that it is permissible. And let's be honest, most of the time, they're just going to do that anyways. Right? So then the question is, how do we walk alongside someone who makes that choice? And here's where I land. I have a robust belief in the sovereignty and providence of God. I just do. And I think that really helps me not be anxious myself in these circumstances when I walk through this with people. When someone comes in and says, I met with my doctor and I decided to do this. I have a robust understanding of God's sovereignty and providence. And so I may disagree. I may have made a different decision for me or for my family. But often what I'll do is, okay, what is wise then in light of these circumstances? And in most cases, I'm just going to say, hey, you know what? I'm going to reserve judgment. I think it's wise to reserve judgment, and let's talk about your heart. Right? Let's talk about, how are you doing? What, obviously, what are the side effects? Helping them walk through that, but then talk about their heart and engage on that level. And a lot of times, if you can help them think biblically about God, about who they are, have a theological view of their suffering, then they're probably going to get to that point where they're going to come, and I've seen it saying, I don't think this is helping. I think I need to get off it. And in my brain, I'm going, yeah, praise God, right? But that's it. Okay, let's talk with your doctor. Let's do it the right way, right? But I'm helping them along to get to that point. And so that's where I would tend to land. And so there are times where the counseling may make that decision, but I want them to help if they're going to make that decision for the right goals, and it's not going to fix them. Their hope is not in the medication. In fact, the realization the medication may, if they pick the wrong one, may make things harder. But if they're saying, hey, but I would like to see if this could help so that I can function just in these other areas so that I can have the ability to do the real work that's needed on my heart in this way moving forward. Here's a couple other caveats. I'm going to mention this again. Do not tell your counselee to stop taking their medication. their antidepressants, or whatever it is. That is not our role. Now, do I believe it's in many cases wise that it could be very helpful for them to stop? I do. But that is not your role. And if they're just stopping because, again, you're not building on a ground of theology. You're not helping them make that decision because they are trusting in God and in His character and from learning and that. They're just saying, because you're the spiritual guru that told them, I'm going off my medication because, this person told me to. I just don't think that's helpful. But no matter what, don't tell them to stop, because they need to be able to work with a doctor. You don't want further withdrawal and side effect symptoms. There's all kinds of withdrawal symptoms that can happen in the withdrawal of these medications. Any stopping of medication must involve their doctor. And it's sometimes, that might mean, going to visit their doctor with them. A lot of times, I've asked if they want me to do that. I've not had one take me up on that. I don't know, Michael, have you ever had one take you up on that? Usually it's coming back and talking through with them. Hey, tell me about the conversation with your doctor, and just gathering data. I'm always gathering data. I'm always asking about the data of those conversations with their doctor. When the last time is with their doctor. There's some people I've talked with, and they're on a medication. Like, hey, when's the last time you've even talked with your doctor about this? Oh, like 10 years ago. Oh, well, that might be a good conversation to have, right? And so there's always data gathering. But if they're going to stop, if you talk with them and they say, you know what, I think, and you talk together that it's a wise time to stop and to taper off, you need to make sure they're working with the medical professional as they do that. Let me put things together this way. I really liked this. I took this from another doctor, Dan Dione. He came here and did some training at Kingsburg for a couple years. And so he's a medical doctor, I think general practitioner, and a biblical counselor. And these are his suggestions when he does training on this issue. And again, I think because of his role as a medical doctor, his role as a biblical counselor, I think he has a lot of help and wisdom. And so these are his put-offs and put-ons for biblical counselors as they think about medication. So put-offs, do not judge counselees if they are on medication, right? Do not judge them. It's not just idleness. There's real suffering involved. There's probably weakness and faint-heartedness. There's a lot of data gathering that needs to be done. Do not make them feel like they have inferior faith if they're on medication. Do not tell them that it is a sin to be on medication. So I just want to make sure that you hear that clearly from me in this session. Do not do those things. That's not what we're talking about here. Are there questions about as we think through what we don't know about the brain, which means, is there wisdom involved here? And questions of wisdom, is this the right thing to do? Yes. There's a lot of questions that not just biblical counselors, but even secular science and psychology and psychiatry are asking. But that should not lead us to judging them or making them feel inferior or certainly not telling them it's a sin to be on medication. So what should we do? Here's some great advice that he gives. Data gather, right? What is going on? What was going on at the time they started the medication? What are they hoping? Here's key. This is heart language, right? What are they hoping the medication's going to do? If I can get my pen's not working. That's okay. What are they hoping the medication? That is a key question, right? If they're saying, you know what, I know that the medication is not going to help me. That's not going to fix me. It's not going to solve me. But what it is helping me with a little bit more, it's helped me physically a little bit so that I can do some of these things of, I know that my real change is going to be reading my Bible and engaging in the church community and seeking to obey God. And this is helping some of the physical symptoms be able to do that, right? Which is very different than, I'm just hoping it fixes me. Right? Huge differences in that question. That's a huge difference in your data gathering. Ask why their doctor prescribes the medication, And were there other medications they have tried, right? And just realizing that one of the things you can realize just from this is that there is so much of this is just a guess and check model of which medication that they are being on. And if they are on a medication, one of the things you can do is you're probably having more connection with them than their doctor is. So if the medication is having a greater negative effect for them, you're going to probably see that as you're meeting with them for counseling than their doctor is, which would, for me, I've recommended you need to go back and see or talk to your doctor, and you need to tell them, here are the added symptoms that this is going on, so that you can work with them on whether it's, that this is not a good medication that it seems like, so that they can talk with their doctor about that. So you're talking with them about other medications they've tried, about side effects of the medication. Ask how the medication has worked for them, right? Asking about that, because again, if they're going to as they see the heart change, especially if it's more of a mind, mental, heart issue than a brain issue, then they might, I've seen a lot of people that I've counseled get to the point of, it doesn't seem to be doing anything anymore. Well, that's interesting. Well, what do you think we should do about that, right? Again, you can ask if you can go with them for the next doctor's visit. I haven't seen that. Maybe in the question answer time, I don't know if Brendan has. But here's the big one, right? Get to work talking about their heart issues. And help them see that's where their hope is. Their hope for change is it cannot be rooted in the pathology of their brain. Because it just can't. And that we would put their hope that change is possible, no matter what is going on, because we know that the mind and the heart can change, can be renewed. Let the doctor focus on the outer man and the medication, but we want, as a biblical counselor, we want to focus on the heart issues. We want to help them think biblically about their diagnosis and how, no matter what diagnosis they may have, they are responsible, and they can be responsible for the choices and the sin and the behavior in their lives, no matter the increased challenges of their circumstances and temptation that we have. And so, as a biblical counselor, it doesn't mean, their medication, I can't talk to anything about that. It's saying, yes, you're not a doctor, you're not prescribing, you're not de-prescribing, but you can challenge the idea that the outer man treatments will solve the inner man heart issue. That you can and you should challenge. That is something that you want to, if they're idle about that, it needs to be admonished. For most people, they're just weak. They just don't understand. They've never thought through what would the problems actually be that they're facing. And so what they need is they need help. They need help to find actual hope that what is the inner man issues, and that there's actually hope for change there. That you can challenge the idea that any medication is going to, quote unquote, solve their problem. It is your responsibility as a brother and sister in Christ to help them find hope, not in maybe guessing the right medication, but the hope and the transformation of the mind and the heart that God's word can give to them. And we recognize, yes, the outer man can affect the inner man can affect the outer man, but we also recognize what Jesus says. It's out of the heart that the mouth speaks. It's out of the heart, right? Back to our tree here. It's out of the heart that this behavior comes. And so that as we look for what is the most effective way to give hope and to give help for change, it's actually not the brain. It's the heart. It's the same thing that as I counsel a young woman, I've talked before with chronic pain syndrome. It's not the brain, it was other issues in the body. And there's nothing that I could promise her. There's nothing the doctors could promise her for any change. Very similar to what Michael just talked about with issues in the body. And yet, there was hope and there's help for her. Why? Because her mind could be renewed. Because her thoughts could be renewed. Because her heart can be transformed through the Word of God. That's the same thing as we talk about the brain. That's the same thing as we talk about even what we don't know about the brain. Because we understand that it's out of the heart that flows the streams of life. All right, we got a couple minutes. Actually, before we do that, we're going to go through the case study I was going to touch on that, but we're going to talk about that later. Let me give those resources again. There's a couple sources there, but those 2 resources you have on that last page. Charles Hodges, Good Mood, Bad Mood. Again, I am not a medical doctor. Charles Hodges is. And he's done extensive work, both from his perspective as a medical doctor and as a biblical counselor. I think it's a very helpful read that I recommend. And then Jen Chen, Biblical Counseling and Mental Disorder Diagnosis. And then, Michael, you were just talking about Greg Giffords. That's one I hadn't heard of when I wrote up my notes. Lies My Therapist Told Me. All right.